Good morning. Happy Midwife Monday. Thanks for joining us here at the Santa Clarita Birth Center for another one of our Midwife Mondays. So today we're going to talk about breastfeeding while you're pregnant. That issue has come up quite a bit in the last couple of weeks here because we have a few of our moms that are doing just that. They are breastfeeding while they are still pregnant. And there's a lot of misinformation out there about whether it is safe, whether the biggest issue is it safe? Is it okay to breastfeed when you're pregnant? And a lot of times when you are getting the medical model of care, sort of the rule of thumb is wean the baby. Well, first of all, let's reel this back a little bit. Many women don't get pregnant while they're breastfeeding. But you have to remember that breastfeeding is not birth control. 80% of women will not cycle for the first 6 months postpartum. 20% of us will have a fertile ovulation within the first 6 months of breastfeeding. But after 6 months, generally that's when women's periods may start. Anywhere from 6 months postpartum up till, who knows, maybe till you stop breastfeeding. But so one important thing is breastfeeding is not birth control. You will have a fertile ovulation before you get your period. So what we talk about at the 6-week postpartum mark is, if you're choosing to have more babies or not have more babies, what's your plan for child spacing? Because you will have a fertile ovulation before you get your period. That's only 20% of us before 6 months. So if you are in the category where you are still breastfeeding and you're cycling regularly and you are pregnant, yes, you can continue to breastfeed during your pregnancy. Many women's supplies will start to go down, certainly within in that first trimester, second trimester, the supply starts to really go down. And some babies will naturally wean at that point. I know my own personal experience. I breastfed till I was about 6 months pregnant with my second son, and we weaned kind of spontaneously without a problem. At that point, my son was about 2. And so it was a pretty easy weaning process. He just sort of stopped and my supply tanked, and that was the end of that. But for many women, those babies depends on how close in age your babies are, right? If you're just 6 months postpartum and you're pregnant, you're still pretty much exclusively breastfeeding that baby. So yes, it is safe. Your supply will ultimately go down because you're pregnant, so your body is starting to take care of the baby that you're growing more than it's supplying milk for the baby that's outside of your body. So one big issue is to make sure that you stay hydrated when you are breastfeeding and pregnant at the same time. You need a bit more calories, so some women will experience a little bit more morning sickness when they are, it's not considered tandem nursing yet. It's tandem nursing is when you're breastfeeding 2 children at the same time, but sort of breastfeeding through pregnancy will sometimes lead to what's called tandem nursing 2 children at the same time. But in that first trimester, if you're still breastfeeding, you may notice that you need to really hydrate well, and you need to eat more frequently because your blood sugars are going to be going down because you're still using up a lot of calories when you're breastfeeding. And then you might notice that the baby that's at the breast is starting to get really fussy and a little bit cranky and wants to be on the breast all the time because your supply is starting to go down. That's normal. That's what happens when you're pregnant. It's the hormones of pregnancy are decreasing that supply, and your placenta is growing, and all of those things decrease your supply. So someone called me recently and said, what can I do? I have I think the baby was about 14 months, and the mom was still breastfeeding, which is terrific, and she was pregnant and her supply was going down. She's like, what can I do to increase my supply? There's not a whole lot you can do to increase your supply at that point, because it's the body is winning, right? The pregnant body is really paying attention to that fetus that's growing inside of your body. So you can do some herbs that are safe in pregnancy, but they're not going to really change much. Your supply isn't going to go up at that point just because you're pregnant. So the best thing you can do for your supply, if you're concerned about it, is to make sure you're hydrating and getting enough calories. Other than that, there's not too much to do to increase the supply because it's decreasing because of the pregnancy. Does that make sense? And a lot of people will say it's not safe, right? It's not safe to breastfeed if you're pregnant, because breastfeeding can cause uterine stimulation, can cause contractions, and you'll go preterm. Well, no. No, really. No is really the answer to that. Unless, of course, you have a history of multiple miscarriages. I would suggest if you've been pregnant, if you've had multiple miscarriages, then you might not want to be breastfeeding while you're pregnant at the same time, because we want to do everything we can do to make sure that environment is really safe for the baby and there's nothing that's going to disrupt it, right? So we're not generally seeing that with women that are pregnant and breastfeeding at the same time. We're not seeing increased risk of miscarriages. The one caveat is if you've had a history prior to your pregnancies of multiple miscarriages, then I would say, yeah, you might want to wean your baby before trying to get pregnant again. Otherwise, there are no risk factors generally that if you spontaneously conceive during your breastfeeding time, you're going to be fine. Your body's already used to having that stimulation, so we do not see an increase in preterm births. We don't see an increase in miscarriages. We do believe it is safe, and if it wasn't safe, your body probably wouldn't be able to get pregnant, right? Your body is very smart. There's lots of wisdom in our bodies. So if you are having a fertile ovulation, the body is saying, yeah, I'm ready to be pregnant again. And so, again, unless you have a history of multiple miscarriages, 3 or more miscarriages, then you're going to be fine while you're breastfeeding, while you're pregnant. Also know that for some women that are breastfeeding when they're pregnant, there comes a time in the pregnancy where they start to get like an aversion to the baby outside your body being at the breast. There's an aversion. Some moms say, it makes my skin crawl. I just can't put the baby to the breast anymore. I feel like such a bad mom. Why is this happening? Just know it's normal. It is so normal. So many of our moms are just, they get to this point hormonally and they really want to be done. When that happens, one thing that we recommend is that you don't cold turkey wean your baby. That's never really fair for anybody in this dyad, right? A dyad is a mom and a baby, right? It's the two of you together. So we never recommend cold turkey weaning, because that can be really emotionally difficult on the child that's breastfeeding. So we do talk here about ways to start talking about maybe having a conversation with your child about, mom has got a new baby growing in her belly. It's starting to be a little bit difficult for mama to, feed you, for you to have breast milk, or for you to drink the milk at mama's breast, or however you talk about it. It might be, it's hard for mama, it hurts mama. And then you could maybe start putting some boundaries around your breastfeeding experience with your child that's at the breast. Talking together as a dyad, how can we work this out together? With one of our moms, I think the baby's only nursing at night to go down for bed. And she doesn't even need to nurse to go down for bed. Dad's able to put her down for bed on the weekends when he's home. So clearly this baby knows how to self-soothe. She knows how to go to sleep on her own. So we talked about maybe talking about setting a timer and saying, we can nurse you for 5 minutes tonight. And then you set a timer and you both know when that timer is going to go off. And then maybe the next night you decrease it to 4 minutes. I mean, there are lots of little tricks of the trade that you can get if you're choosing to wean that baby during your pregnancy time. Or if you want to continue to breastfeed during your pregnancy time, you can totally do that, and it's fine and safe. We had one mom who, it was beautiful. In her labor, her son came over and he was nursing. Not a ton, but a little bit. And it was actually just remarkable and beautiful that she was able to, for a moment, give him that attention during her labor time. And then he toddled away and was busy doing his own thing, and she had a beautiful birth, and she went on to Tandem nurse her children. We have lots of moms that go on to Tandem nurse, and that's really special. It does take a lot of energy. It takes a lot of patience. It does take a little bit more calories and certainly more hydration when you're breastfeeding 2 babies, but it can be quite beautiful. It's not for everyone. It is challenging. I think the biggest thing we see with Tandem nursing is that mom sometimes really needing her body to herself for a little bit, and so you get really super touched out. I've never personally Tandem nursed. I intended to Tandem, but we weaned when I was 6 months, and that worked great for us. And that's just sort of how our family evolved, right? I didn't really have a set agenda. But if you are Tandem nursing, what I hear, the feedback that I get is it can be really, like, moms really need a minute to themselves sometimes. Their body is just super tapped out. and really touched out. So just recognize that that's real and it's appropriate and it's okay as a mom to say, I just need my body to myself for a little bit, and maybe work out some boundaries in there for you after the baby is born. What we do recommend when you're tandem nursing is that the new baby always gets to feed first, right? We want to make sure that the new baby gets their belly full, because when your milk comes in, if your toddler is nursing and they are super into it and they just are loving that milk, but we want to make sure that the baby gets fed first so that baby is properly growing. So the take home from this quick little Midwife Monday is, yes, it is safe to breastfeed while you are pregnant. It can be challenging, it can be emotionally difficult, and that's okay and it's normal, and it doesn't mean you're a bad person or a terrible mother. It just means you might need some boundaries with breastfeeding. You will hear a lot of cultural bias saying it's not safe, don't do it, you're depriving the baby inside your body. Our bodies are very smart. Our bodies know how to take care of our babies in our bellies, so it is safe. Drink some more water, make sure you're hydrated. If you're having signs of lots of nausea, vomiting, headaches, symptoms, talk to your healthcare provider. Come in. If you're with us, come in and talk to us about it. We're going to help you kind of manage that. But know that it is okay, and we support it. We think it's awesome. And if you want to wean, there are ways to do it that are appropriate for both you and the baby. But remember, your baby has a point of view about this. And our opinion is that it's a two-person, it's a partnership. So we really encourage you to have dialogue with the other person in that partnership with your child. Depending on, no matter how old they are, your baby always deserves to have a dialogue and say, look, this is something that mama needs to do, and this is what we're going to work on. And you're going to use that language that's appropriate for whatever age your child is. So the take home is, yes, it is safe. Yes, it can be difficult. Yes, it can be beautiful. And yes, you can breastfeed two babies at the same time. So hopefully that's helpful for our mamas out there. That question, again, has come up a couple times in the past week. So I hope that helps. Thanks again, you guys, for joining us on Midwife Monday. I hope it's enjoyable for you. I super like doing it. And if there's a topic that we haven't covered that you really want covered, please either, post here on Facebook, write a comment of what you want us to talk about. You can always call the office. You can email us. You can follow us on Instagram as well. And yeah, thanks for joining us, and we'll see you next week.